Terry Walker, and I'll be facilitating the Village's Health presentation on the best skincare over age 60. Please keep in mind that the information contained in this presentation is for educational purposes only and is not intended to take the place of advice from your healthcare professional. By the end of today's presentation, I hope that you'll have a better understanding of the composition of your skin at the molecular level, how and why skin changes as we age, learn a little bit more about the skin diseases and conditions that are possible to develop, and what we can do to better protect our skin as we age. Skin is the largest human organ, accounting for approximately 16% of our overall body weight. Skin's primary role is to provide an interface between our internal and external environments, protecting our bodies from things like UVA and UVB light, chemicals, and microbes. Skin is a sensory organ detecting heat, pain, and pressure. It's primarily divided into 3 levels, seen here. On average, human skin is 1 millimeter thick. The 3 layers pictured here are the epidermis, the dermis, and the hypodermis, which is actually in the subcutaneous tissue. Taking a better look at the epidermis, it's actually divided into quite a few different levels. The outermost level, called the stratum corneum, consists of keratin or keratinocytes, which produce keratin cells. The cells located on this level are actually dead. They work along with the stratum granulosum to provide a waterproof layer protecting our skin from the penetration of water through to our bodies. The little granulated dots you can see in the stratum granulosum are actually little lipid cells or fat cells that help to waterproof the skin. The stratum lucidum shown here is actually only present in the thick skin on the palms of our hands and in the soles of our feet. The stratum spinosum is the largest level of the epidermis, containing the squamous cells. The basal cells at the bottom are like a basement membrane. This is where the skin cells actually originate in the epidermis. In the cell cycle, cells begin in the basement layer of the stratum basale, and they begin pushing their way upward toward the surface, flattening out as they go and dying as they come up. Some of the other specialized cells that are found in the epidermis include a melanocyte, which contains the melanin or the color that you obtain when your skin is exposed to sunlight. Merkel cells are located in this level that detect general pressure on your skin. And lastly, there's a specialized cell called a Langerhans cell, which scurries through constantly looking for microbes or anything that is bacteria on our skin so it can consume it and get rid of it. The next layer in is the dermis. The dermis connects the epidermis to the rest of our body. This level contains certain specialized cells, as you can see here. There's sebaceous or oil glands, which produce the oil that lubricates our skin. There's hair follicle cells, and there's also sweat glands, which help to cool our skin down. Blood vessels and nerve endings are also present in this level. Some of the specialized nerve cells include those that detect temperature, pain, and additional pressure. The last level in the skin is called the hypodermis, largely composed of loose connective tissue or adipose tissue, the fat. This loose connective tissue or fat is what gives our skin the plumpness or softness that we associate with it. Blood vessels and lymphatic cells travel throughout this level, providing nutrition and drainage for nutrients coming and going to our skin. So now that you have a basic understanding of the structure of the skin, let's take a look and see what happens as we age that causes our skin to look different or gain wrinkles. With aging, the outermost skin layer, the epidermis, thins, even though the actual number of cell layers remains unchanged. The number of pigment-containing cells, those melanocytes we saw, decreases. The remaining melanocytes increase in size, causing some large pigmented spots called age spots, which you may have noticed. Changes in the connective tissue layer, where the elastin and collagen are located, reduce the skin's strength and elasticity. They are no longer able to provide the nice solid structure or base underneath the epidermis. And as a result, wrinkles form and skin sags. The blood vessels in the dermis also become more fragile. This can lead to bruising or increased likelihood to bruise or rosacea. Sebaceous glands, the oil glands, produce less oil as we age. Men experience a minimal decrease mostly after the age of 80. Women, however, gradually start beginning a decrease in oil production after menopause. This can make it harder for women to keep their skin moist, resulting in dryness and itchiness. The subcutaneous fat layer, that hypodermis, also declines and thins, so that our skin no longer has that nice layer of insulation and padding. This puts us at further risk of skin injury and bruising. Because we have less insulation, we may experience more hypothermia in cold weather. Sweat glands also produce less sweat. This can make it harder to keep cool, and our risk for overheating or developing heat strokes increases. Recent research is beginning to substantiate that behind sun, sugar is the primary cause of aging in our skin. After the age of 35, we become more susceptible to a process called glycation. Glycation is when excess sugars in the bloodstream attach themselves to fats and proteins in the body, forming something called AGEs, or advanced glycogen end products. This process can also occur in people that have diabetes because they have higher levels of blood sugar. Collagen is the most abundant protein in our body, and as we saw, it provides the structure in our skin that makes it look young. When sugars attach themselves to the collagen and elastin fibers in our skin, they inflict damage. The fibers become stiff, inflexible, and weak. The bonds formed between the sugar and the proteins begin to cause problems. Over time, the accumulation of these AGEs causes an irreversible cross-linking of weakened adjoining collagen. This shows up on our faces as a loss of elasticity, deep wrinkles, and thinning skin with more sagging. Ugh. Pigmentation changes can occur, and the skin becomes dry or rough. AGEs can also cause acne or rosacea to worsen, and the skin becomes more vulnerable to other aggressors such as the UVA rays. So all of a sudden, having that extra slice of cake or having dessert just doesn't sound quite as appealing, does it? Sugar can come in many forms. Processed foods that we don't think of as sweet typically can be loaded with extra sugars. Therefore, it's important to read food labels and understand how foods are broken down. Complex carbohydrates such as brown rice, vegetables, beans, and oatmeal are much better than simple carbs such as granulated sugar, anything with white flour, corn syrup, or fructose. The reason they're better is because foods that rapidly convert to sugar or glucose in your bloodstream can lead to glycation. Glycation. If you're committed to avoiding excessive glycation, you can check out where the food you're eating falls on something called the Glycemic Index. There's a website listed on this slide which provides a great resource, as well as this chart that you see here. Foods that score higher on the Glycemic Index digest rapidly, which produce that rapid rise and spike in the blood glucose level. when it's during this process of the spike in blood sugar when the glycation takes place. So the goal is to eat foods lower on the glycemic index to avoid the glycation process. Sunscreen or no sunscreen? Believe it or not, the two women pictured here are identical twins. These are not pictures of one woman at a younger age and then pictured at an older age. These women are the same age, except that one has spent numerous hours in the sun and the other one has protected her skin and stayed indoors and not been exposed to the sun. Sun exposure causes most of the skin changes that we commonly think as a normal part of aging. Over time, the sun's ultraviolet or UV light damages the fibers in the skin. When these fibers break down, which is the elastin, the skin begins to sag, stretch, and lose its ability to go back into place after the stretching. Sunlight travels to Earth as a mixture of both visible and invisible rays or waves. Long waves, like radio waves, are harmless to people, but shorter waves, like ultraviolet light, can cause the problems. The longest of these UV rays that reach the surface are the UVA rays, and the shorter ones are called the UVB rays. Too much exposure to UVB rays can lead to sunburn. UVA rays can travel more deeply into skin than the UVB rays, but both can affect your skin's health. When these rays enter your skin cells, they upset the delicate processes that affect the skin's growth and appearance. However, your skin does have a way to prevent or repair sun damage. The outermost layer of skin constantly sheds dead skin cells and replaces them, as we saw earlier in this presentation. You may have noticed this type of skin repair if you've ever had a bad sunburn. Your skin may peel, but it usually looks normal in week 2 or 3. When you're exposed to ultraviolet radiation, there is a repair process that goes on constantly in each one of your exposed cells. The problem is, as we get older, it becomes harder for skin to repair itself. And over time, the UV damage on your skin can begin to take its toll on your skin as well as the underlying connective tissue. Too much sun exposure can raise your risk for cancer, which is the most common form of cancer in the United States. In the next few slides, we'll take a deeper dive into each of these different types of skin cancer. Although sun is the primary cause of skin cancer, keep in mind that exposure to the UV rays in sun lamps or tanning booths can also do damage. The origin of each of these types of cancer explains the name of the cancer. For example, basal cell carcinoma is formed in the basal layer of our epidermis in the basal cells. It is the most common type of skin cancer, accounting for 8 out of 10 cases. These cells in the low epidermis constantly divide to produce new cells. As the cells move up in the epidermis, they eventually become squamous cells. Early detection and treatment for basal cell carcinoma are important. The cancer cells can grow very deep, and allowed to grow, it can then penetrate into nerves and bones, causing damage and disfigurement. Squamous cell carcinoma is the second most common form of cancer, accounting for 2 out of every 10 cases. Because these cancer cells develop on the squamous or the exposed layer of the epidermis, you can often see a precursor of them, as you can see in the blurb on the left side of your screen. The actinic keratosis is actually not a form of cancer, but it serves as a warning sign. So if you notice some of these rough patches developing on your skin, don't hesitate to consult your doctor and have them looked at further. Melanoma is the most serious type of cancer. It can develop within a mole that you already have or appear suddenly as a dark spot that wasn't there before. It's called the most serious because it has a tendency to spread into other parts of the body. This type of cancer occurs in the melanocytes of our body, as we saw in the earlier slides, which are housed in the epidermis level. So how do you determine if a spot is cancerous and something to be concerned about or not? Consider the ABCs. What you're looking for is a spot that has symmetry. Looking at the image contained here, between the difference between nice symmetrical rounded shape versus the asymmetrical. You're looking for something that has a nice even border as opposed to an uneven border. Consider the color. If you have a spot, you're looking that it has a singular uniform color as opposed to a multiple color, as shown here. In terms of D for diameter, spots less than 1/4 of an inch typically aren't something to be concerned about, but those that are larger definitely bear looking at. And E for evolving, an ordinary mole is not changing in size, shape, or color. So consider the A, B, C, D, E's of this slide when you're looking at your skin. Remember that you typically are not able to see the skin over your entire body, and make sure to schedule normal skin checks, given the fact that we live in a very warm area of the country. As we age spots, skin tags, and moles are more likely to show up. Typically, they are harmless. Use of a broad spectrum sunscreen with protections against the UVA and UVB rays may help prevent age spots, which commonly show up on the face, arms, hands, back, and feet due to changes in the melanocytes of our skin. A skin tag, as you can see in the middle image on this slide, is a small, soft, balloon-shaped, benign skin growth connected to the skin by a thin stalk. They're extremely common and harmless. Most often, they're found in the creases of our skin, such as in eyelids, neck, and body folds of the armpit, chest, and groin. They are typically harmless, but they can become irritated depending on their location. So you may want to check with your doctor about possible removal. The last image here shows a mole. It's a skin growth that develops from a cluster of pigment cells or melanocytes. They're usually found on areas of the skin exposed to sun. A common mole is usually smaller than 1/4 inch wide, is round or oval, and has a smooth surface, a distinct edge, and is often dome-shaped. Going back to those ABCDEs of skin cancer that we looked at previously. The difference between a skin tag and a mole is that a skin tag is attached to the skin by a very thin stem versus being firmly attached to the skin. Fewer natural oils, sun damage, and decreased cell renewal can all lead to dry, rougher skin as we get older. Loss of hormones can also lead to drier skin. Some of the ways to protect our skin from dryness include the use of moisturizers like lotions, creams, or ointments, taking fewer baths or showers, using a milder soap without fragrance or harsh chemicals, using more of a tepid water, shying away from the hot showers that can cause drier skin. Use of a humidifier might be something to consider if you notice that you have dry air in your home. And if you still find that you have the dry, rough patches that are itching you, consult with your physician about getting a topical corticosteroid, which has been shown to help in some cases. The cause of thinning skin and increased likelihood of bruising as we age is actually multifactorial in nature, meaning there's a lot of different causes. One is the dermis level of our skin produces less collagen, rendering the skin less able to repair itself and having less structure. Sun exposure can break down that collagen and elastin further. Cells that make up the layers of our skin shrink and decrease in number. And the fatty layer beneath our skin, which acts as a cushion, thins out also. Men's skin is roughly 20% thicker than women's, mostly due to higher levels of testosterone. As we age, collagen production declines in both men and women, but women lose it more rapidly than men, especially after menopause. Because there isn't much of a cushion there when bumps happen, just a minimal trauma can lead to bruised skin. Rosacea is a common skin disease appearing as red bumps or pustules on the face, ears, and neck, and sometimes the chest. It makes the skin swell and blood vessels expand. In many cases, older adults might experience stinging, burning, or even pain. It could be possibly related to immune system response. It is more common in fair-skinned people. An older person's skin is much thinner and more fragile than when we're younger, making it more susceptible to painful skin conditions. Common triggers are sun exposure, strong winds, spicy food, alcohol, and stress. Hot water, such as from a bath or a shower, can also aggravate it. You may want to check some of the makeup and skin products you're using, which could trigger some redness that you didn't used to have a problem with. Diabetes can affect the outside of your body on your skin as well as the inside of your body. Some of the general skin conditions that diabetes can affect are the top three: bacterial infections, fungal infections, and cause itching. Bacterial infections of the glands of the eyelid, boils, follicles, carbuncles, which are deep infections of the skin and tissue, and infections around the nails. Inflamed tissues are usually hot, swollen, red, and painful. Fungal infections can also occur. The culprit is often Candida albicans. This yeast-like fungus can create itchy rashes of moist red areas surrounded by tiny blisters. Problem areas are usually under the breasts, around the nails, between fingers and toes, in the corner of your mouth, and in the armpits and groin. Localized itching is caused by diabetes, and it can also be caused by that yeast infection, the Candida, dry skin, and poor circulation. Listed below are specific diabetes conditions associated with the skin. We're not going to go into them more in this presentation, but I would encourage you to consult with a dermatologist if you do have diabetes in order to better prepare your skin and keep it safe from any of these. It's important, if you have diabetes, to take skincare seriously. Limit your sugar intake and high glycemic foods to avoid glycation. Make sure that you dry your skin and treat anything that you see right away. Recognize that your skin is more sensitive and prone to certain conditions more so than others without diabetes. So make it a regular practice to check your skin for any changes. Nutrition is one of the greatest ways we can equip our skin to age successfully. Some of the tips include limiting sugar intake and high glycemic foods to avoid glycation, as we spoke of earlier. Consuming foods with healthy fats and oils, such as omega-3, can greatly impact your skin by increasing your skin's collagen production, making it appear smoother and more supple. Keep in mind, when changing your diet, it's important to be patient. It can take up to 12 weeks or 3 months for a dietary change to have noticeably a different effect on your skin. I want to encourage you to be patient, because if you think about it, if you are trying something and it's taking at least 2 to 3 months, that's about the time frame when you would be willing to throw in the towel. But keep going, because fruits and vegetables contain powerful antioxidants that protect the skin from cellular damage from free radicals. Free radicals are produced by our body through normal metabolic process when we exercise. But exposure to smoking, pollution, and sunlight can increase the amount of free radicals in our body. So consuming foods with beta carotene found in carrots and sweet potato and any of the orange or red vegetables can help neutralize those. Selenium is also another powerful antioxidant. It works alongside antioxidants such as vitamin E and C to support the immune system. Studies are showing that a selenium-rich diet can help to protect against skin cancer, sun damage, and age spots. Some of the foods containing selenium include Brazil nuts, fish, shellfish, eggs, wheat germ, tomatoes, and broccoli. Sources of vitamin E include almonds, avocado, and other nuts, and corn oil. Vitamin E protects the skin from oxidative cell damage and supports healthy skin growth. Vitamin C is another important antioxidant. It's needed to support the immune system, promote radiant skin, and help blemishes heal properly. Sources of vitamin C include blackberries, blueberries, broccoli, guava, kiwis, orange, strawberries, and sweet potatoes. Vitamin C is a precursor for the production of collagen in the skin. And lastly, a reminder to hydrate. Skin needs moisture to stay flexible. Even mild dehydration will cause your skin to look more dry, tired, and fatigued. Drink 6 to 8 glasses of water a day. All fluids count towards your daily allowance, but water is the best. If you find yourself busy and on the go constantly, make sure to pack a water bottle so that you can sip water throughout the day, even if you're not near a water fountain. This next slide is my fun slide, I call it. All of us are looking for a quick fix in terms of a cream or an ointment that we can put on our face to make us look younger. I researched that the Mayo Clinic has identified the ingredients listed here as ones that actually make a short-term difference and may improve the appearance of our skin. So I'll go through them right now with you. Retinoids. This is a term used for vitamin A compounds such as retinol and retinoic acid. These ingredients have long been used topically to help skin repair sun damage and reduce fine lines and wrinkles. A vitamin A derivative, it increases cell turnover deep within the skin. And when these new cells are exposed, skin looks lighter and brighter. Vitamin C, as I had said in the previous slide, is a precursor to collagen production. It's a potent antioxidant, which means it protects the skin from free radicals. Vitamin C may also protect the skin from skin damage and reduce fine lines. Before and between uses, wrinkle creams containing vitamin C must be stored in a way that protects them from light and sunlight, because vitamin C can be broken down that way. Hydroxy acids. These are used to remove dead skin cells or help exfoliate that layer of keratin on our skin. Using a hydroxy acid product regularly can prepare your skin to better absorb other products and stimulate the growth of smooth, evenly pigmented new skins. Coenzyme Q10. This ingredient may help reduce fine wrinkles around the eyes and protect the skin from sun damage. Peptides are molecules occurring naturally in living organisms. Certain peptides are able to stimulate collagen production and have been shown to improve skin texture and wrinkling. The next one I'm not going to try to pronounce for you, but the one beginning with the letter N is a powerful, potent antioxidant related to vitamin B3 production. It helps reduce water loss in skin and may improve skin elasticity. Tea extracts found in green, black, or oolong tea contain compounds with antioxidants and anti-inflammatory properties. These, through the reduction of inflammation, can cause your skin to look tighter. Notice I say use the term look tighter. It's not actually helping your skin become more young, it just looks tighter. And grape seed extracts, in addition to their antioxidant and anti-inflammatory processes, also promote collagen production. So keep in mind that the Food and Drug Administration classifies creams and lotions such as those items contained in the lotions and potions as cosmetics. Cosmetics are defined as having no medical value, so the FDA regulates them less strictly than it does drugs. This means that cosmetic products don't undergo the same rigorous testing for safety and effectiveness that topically applied medications undergo. So any claims made by manufacturers don't have to necessarily adhere to the standards of efficiency and efficacy that they claim. So at the end of the day, there's no guarantee that any of these over-the-counter products will actually reduce your wrinkles on a permanent basis. When assessing the effectiveness of an anti-aging cream, it's important to consider cost. Remember that lower dosage of those ingredients listed in the previous slide are on non-prescription or over-the-counter options. Multiple ingredients in a lotion can deactivate the potency of others. Consider using, when you use a cream, you need time to allow it to build up its efficacy. Some creams take over 30 days before you notice a difference. There could be certain side effects, especially if there's a fragrance in them, so be sure to test it on a small area of your skin before using it all over. And then remember, what works for your friend might not work for you. So again, make sure that you test it on a small area of your skin before using it on a larger area or investing significant amounts of money. At the end of the day, here's a checklist of proven things that will help maintain your skin as it ages. The number one thing is to protect it from sun. Sun is the number one agent that ages our skin. As thinking back to the slide of the two identical twins, noticing the huge difference, even though they were both the same age, of the one that had protected her skin from sun damage and the other one who hadn't. Choose products with built-in sunscreen. Even there's clothing with smart fibers in it that will protect your skin from damage. If you find yourself at an outdoor event, try to seek shade if you can. Remember that as our body is changing, our skin is changing too, and moisturizers and creams that may have been effective for your skin when you were younger might not be the best match when you're older. You may need a more emollient formula, for example. Remember that your skin is getting thinner as you age. Don't be so harsh on it. You may want to consider exchanging your buff puff or bath brush for a softer cloth. One strategy to keep your skin more hydrated is to gently pat the water from your skin after you get out of the shower or bathtub, leaving a little bit of a layer of moisture on. Abstaining from smoking will reduce your skin's exposure to free radicals, keeping it younger. Reduce alcohol consumption and stay hydrated. Alcohol consumption can tend to pull moisture out of our tissues. Avoiding sugar will help abstain from that glycation process, which ages skin. Eating a diet rich in antioxidants that will neutralize the inflammation and free radical damage to our skin will help. Vitamin D is helpful to healthy skin as well. Make sure that you manage chronic disease conditions such as diabetes and kidney disease, which can wreak havoc on skin and result in many different conditions that are not comfortable. Make sure to wear gloves when doing housework or gardening to protect aging skin from harsh chemicals or rips or tears. And lastly, remember to be vigilant, keeping an eye on any changes to your skin and seeing a dermatologist regularly. At the end of the day, our body is changing as we age, and our skin is no exception. It becomes thinner, loses fat, and no longer looks as smooth as it once did. Scratches and cuts can take longer to heal and be more likely to aggravate our skin. However, hopefully you've learned that through lifestyle and environmental conscientiousnesses, we can make a difference in terms of how our skin reacts to our environment. So at the end of the day, there's much that you can do to protect your skin and help you look and feel better as you age. I hope you've enjoyed this presentation. If you have any further questions, don't hesitate to reach out to the Village's Health. Thank you.